Hey, bitches, today we have a special guest, Dr. Sarah Tillay. Now, Dr. Sarah Tillay was one of our clients over at Venus for quite some time. And as we moved through sessions with her, I found out she was a doctor of physical therapy. And we had her on today to talk about pelvic floor health as it relates to women in general. But we did also talk about some issues that men experience with pelvic health. We talked about potential issues with sex pain, orgasm, struggles with orgasm, issues with bladder leakage, jump ropes. Do you ever pee when you jump rope or do box squats? And then we talked about some more serious issues with the pelvic floor, the types of exercises and some tips and hints and strategies for strengthening your pelvic floor, relaxing your pelvic floor, just depending on what your symptoms may be. She offers some great feedback there. And then also some misconceptions and myths about the pelvic floor. And one thing she did want everyone to take away is there's nothing to be ashamed of. So if these issues or situations sound like anything you're dealing with, dive in today and hopefully you can meet Dr. Tillay yourself. She's amazing. All right. Enjoy the episode. Boss bitch. Welcome. I'm Diane Flores, a former overweight, unhealthy, single teen mom living on all forms of government assistance turned IFBB bodybuilding professional. And I'm also the creator of Venus Fitness Studio, which is an all-women's personal training gym with a team of personal trainers transforming lives in our community of Modesto, California. I'm also the founder of the Goddess Body Elite competition team with athletes all around the world and a team of coaches helping women achieve greatness they never thought possible. But it wasn't all that long ago that I lacked the knowledge, the confidence, the budget, and the time to focus on changing my own health, my own body, and mindset. Fast forward past many failed attempts and lessons learned, I stepped on stage 16 times, earned the prestigious title of IFBB Pro, and in that process have created a formula for our clients that's changed lives and gives me more freedom and confidence in my own body than I ever thought possible. One that only existed as a daydream. My team and I now teach others through training clients in the studio, online programs, competition coaching, and now this podcast that you're listening to. I created the Boss Bitch Radio podcast to give you simple, actionable, step-by-step strategies to help you make profound changes in your life. If you're an ambitious fitness junkie or one in the making who's looking to up-level your confidence, create a body, mindset, and a life that you love, you are in the right place, Boss Bitch Bestie. I freaking love you, and let's get started. Well, since you have been to the studio, I have a podcast. And so we've been doing it for about 2 years now. And I use it as a platform to just share all fitnessy things from my perspective and then also educate women on different things through health, fitness, and all the things, sexuality, all that fun stuff. So I thought it would be fun to bring you on today and talk about pelvic floor stuff.
I always love talking about pelvic floor stuff.
I know you love talking about pelvic floor stuff. I love it. Yes. So before we dive into that, will you just give everybody a little bit of a background as to your expertise in this field?
Yeah. So I am a doctor of physical therapy, went to school, got my doctorate. And then I further specialized postgraduate studies in the specialized field of pelvic health, not to be confused with public health, which most people think I'm saying.
Yes.
So I treat men and women, but my passion area is treating women with all manner of pelvic dysfunction, but specifically as it relates to a lot of the things that happen postpartum, during pregnancy, birth prep, etc. And postpartum is not just the first 3 months after a baby. Technically, I think they label it as up to the first 2 years, but in my opinion, unless you got treated for it and you don't have symptoms anymore, postpartum's for life. Okay. So it can be, you could be 50, 60 years old and technically have symptoms that you've had since postpartum that I work with people on. So yeah.
What are some common symptoms that you typically see when it comes to pelvic floor health or pelvic floor dysfunction and issues with pelvic floor?
There are a lot. I would say probably the most popularized, most well-known ones are leakage of urine.
Mm-hmm.
That can happen with coughing, sneezing, laughing, lifting, jumping, long-term standing or carrying, running, like athletic feats that are more loaded in that way. But most commonly people are like, oh, when I laugh, I sneeze a little bit, that's normal, but it's not really normal. It's just common. And so those types of things are considered dysfunctions, even though they're very commonly discussed. That's kind of a typical one with urine loss. But another one that's really common is actually pelvic pain.
Oh.
So pelvic pain can range from tailbone pain to intercourse pain to more just like a tight kind of achy, or like I'm sitting on a rock type feeling. That can happen often. But more often than not, that actually manifests itself as hip pain or abdominal pain. So pelvic dysfunction can actually feel like dysfunction somewhere else, and it could be originating there.
Okay. Yeah. Now, what are some common, we talked about some common causes of the dysfunction. When it comes to pain during intercourse, because you did mention that briefly, what are some of the common causes of pelvic floor dysfunction in relation to leading to pain with that?
Yeah. So I would say, depending on the season of life, if you're postpartum, most common is scar tissue.
Okay.
And typically that can last over a year without being, even over 2 years. But most commonly that's within like the first 6 months to a year period of time with the scar tissue component. But if you're not initially postpartum or you're having pain pre-pregnancy or starting way outside of a pregnancy situation, muscle spasm in the muscles of the pelvic floor is the most common cause of painless sex or intercourse or whatever we want to call it on the podcast today.
We talk all things.
Yeah. Okay. Yeah. So me too. I was like, we're pretty open to words on that.
Totally. So what are some like common things that you can do? Are there things that you can do preventative wise for like the pain during intercourse, the dribbles of urine and things like that? Because I think giving some like really actionable tips and stuff would be helpful.
Yes. So I guess I'll pick kind of a patient demographic that I'm, everybody's so different, but we'll kind of just go with not that initial postpartum period.
Yeah.
We'll just say athletes in general. Hey, hi.
Hello, little one. Hello. We have a guest on the podcast.
We're going to have a little burp session here. So.
That's great. I love it. Hopefully it's a big Shrek burp. I want to hear that.
Yeah, I hope it's a good one. Then we'll switch and see if he wants to go again.
Yeah.
So for just like, think athletics in general, think prevention. A lot of the ways that we load our pelvic floor, say we're lifting weights, you're doing deadlifts, you're doing leg presses, whatever it is, but it's loaded pretty heavy. The way that we breath hold or don't breath hold and where we channel that pressure can long-term wise, not just like with one lift or two, we're not talking short-term, we're talking repetition, can load that pelvic floor in a way that lends it to being easily strained. So for example, if you're doing this Valsalva breath hold all the time with like every lift pretty much, and your pressure is being put down into those muscles, you can even cause organ prolapse that way without ever having a baby.
Oh, wow.
Right. So that can cause to weakening of those muscles, that can cause leakage. But probably the most common that I see with athletic individuals, such as yourself, and even though I'm not in an athletic stage in life, such as myself,
yes,
it's actually a tension issue. So often people they carry too much clenching. They're trying to hold to stabilize, and they don't know how to relax. And so those muscles stay in this tightened state. And so if you think about like a bicep or a quad or whatever other muscle group that's more visible, if that muscle is not flexible and doesn't have good range of motion to be able to lengthen, and you're trying to strengthen it, you're setting yourself up for injury, right?
Okay. Yeah.
So the same thing happens in the pelvic floor. And most of the type A, work my butt off, I'm going to do everything the best of my ability type personalities are often in fitness. And
you smile very big at me when you say that.
Yeah. And I smile at myself because every athletics are so different. They're not all weightlifting, but athletics, generally speaking. tend to be tension related. So you can actually have urinary leakage in relation to tension, and you can have all the pain symptomology, and it can just become this compounded issue that's really challenging for clients, patients, however we want to refer to them.
Yeah. So let's take a couple steps back. Can you just give us a layman's description of what the pelvic floor entails? Let's do that.
Let's start there.
Yes.
So generally speaking, like that saddle region between your legs from the pubic bone back to the tailbone, kind of slingshots, and then it broadens itself out and attaches to like those bony parts on your butt, which are your ischial tuberosity, your sit bones. So the pelvic floor is kind of like this hammock or this sling that is supportive of the organs that sit on top of it, which are your bladder, reproductive organs, and your rectum, or where you poop from, right? So you have 3 holes, especially female anatomy right there. And then those pelvic floor muscles surround them and support the organs on top. So that's generally speaking where the pelvic floor is. However, it is not an isolated muscle that works on its own.
Okay.
You can contract a bicep and do pretty isolated bicep contraction, but functionally doing an isolated pelvic floor contraction doesn't really happen. So it works really closely with deep abdominal stabilizers, as well as back stabilizers. And the other most significant muscle it works closely with is your diaphragm for breath.
Okay.
And so the pelvic floor in of itself is really part of a large system of stability. And if we're only looking at the pelvic floor, we're only doing kegels. Most people know about kegels. We're only doing that contraction. It's really not functional. Like unless you're trying to just learn how to do one isolated contraction, that's fine. But if you're trying to strengthen or create stability in those muscle systems, you have to work on a core system. Oh, please don't pull on that, buddy.
It's like, mommy.
Okay.
So, pelvic floor exercises. So kegels were like, is this old school? We don't do these anymore.
Yeah.
Okay.
If you're seeing a provider that is giving you kegels, you should see a different provider. I mean, if that's all they're giving you, okay?
Yes.
It's one thing if they're like, hey, you have no idea where this muscle is. We need to just make sure you can find it and figure out like what's going on there. And they're trying to get you to do some contraction. Sure, that's fine. But if that's your exercise program and that's all they're giving you, that's pretty archaic, and that's not backed up by research or literature right now. So it really is a much more complex system, and just doing kegels all the time, it's fine. It's just really probably not going to help you long term with the leakage that you're having with laughing or jumping or lifting or any of those functional activities. Yeah.
Okay. So pelvic floor, this is going to be a very naive question, so bear with me.
Great. Love it.
Yes. So I have no idea how to phrase this other than, does it have any relation to vagina elasticity and like tightness and things like that?
So most of the time when people ask that question, they're saying, oh, my doctor said, or my partner or whatever said, I have a loose vagina and I want to tighten it up so it feels good for my partner, blah, 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 blah. Okay. Muscle toning does have a correlation to the feeling of, I don't want to use the word tension because that's not really accurate, but there's just a tone that's there. So there's more contact, surface contact, but it doesn't narrow your vaginal opening. It doesn't tighten things up. The only way that gets tightened, which is not a healthy way, is like if you get the quote unquote husband stitch after you have a baby, if you've had a baby before, right? Which is not a healthy practice and it's not done most of the time now.
Okay.
It's actually kind of like mutilation to genital tissue, and it can lead to a lot of complex issues afterwards. But the tone in and of itself, just like if you have muscle tone that you can see on your butt or whatever, tone is a good thing as long as it's not excessive and it has flexibility. It can help you with orgasm. It can help you with more sexual satisfaction for yourself. And that's probably the main thing. Otherwise, the vagina feels pretty much the same to a partner, especially a partner that has a penis, if you know who your partner is.
Yeah.
It's really doesn't change much. The tone in and of itself is what makes things more pleasurable. It doesn't tighten or narrow.
Okay. So if I'm hearing you correctly, if you work on the muscles of the pelvic floor, this can lead to some of these things.
Yeah.
Okay.
So people who are like, hey, I used to orgasm really easily, for example. Is it okay if I use orgasm on your podcast?
Of course. All the words.
Okay, great.
We say all the words here. Yes.
Like, I don't really know.
Bad words, all the things.
Well, I don't use bad words but I'll use the word orgasm.
Yes, ma'am. Let's do it.
Okay. So a lot of times after babies or something like that, people say, man, I used to have orgasm really easily. And now like my orgasm feels like a little bit better than a sneeze. Like it's like what's happening? Like there's nothing there anymore. And
this
a lot
is like
of the
post-baby?
Post-baby, you kind of been stretched. Everything feels a little different. And you're like, man, it's been a year. It's been 2 years. And it doesn't feel better. It can be one of two things. It could be too much weakness, so that muscles are just stretched out. We don't have much tone. It's like that. It's like me. It's like floppy Sarah, who's still recovering from having a baby, and or my core feels like jello, right? Those muscles just don't have much control. And then the other thing is actually too much tension, because it's really hard to go through the orgasm process of that contraction of that pelvic floor muscle. If it's tight, it doesn't have anywhere to go. It can't go through that pulsating contraction range. And so that's another reason from a sexual health standpoint that people see pelvic health providers, is to make sure their muscles can actually perform correctly in a sexual sense, because they also do that in that area. Yeah.
Do you think that the same reasons or the same causes for a weak pelvic floor are the same ones for the like contracted, or is it usually two different situations?
It's usually two different situations. High stress individuals, 80% of people with pelvic floor pain have some sort of anxiety. So that's a pretty strong statistic, right? So if we're running we're just these worriers, we run with high stress, we kind of run with this typical, even if it's non-diagnosed anxiety like disorders, 80% of people associate themselves on surveys with having higher anxiety when it comes to pelvic pain or tensioning issues. So generally speaking, that is going to lend itself more to a tight pelvic floor situation. And then you're going to have your not very active, especially older individuals, or initially after having a baby. Those are normally the causes of weakness. So in athletics, say if you're having urine leakage and you're having any of that, it's normally due to tightness, which can mask weakness. Weakness can be an undertone there, but tightness is normally the initial thing that needs to be worked on. And then weakness can come afterwards. Yeah, that you have to deal with. It can be compounded.
Okay. Any lifestyle changes or habits for either of those? Okay.
Yeah. So if I gave just a general, here's my 2 cents on, hold on, let me put this baby down. My 2 cents on best things you can do to work on tension. My first thing would say you need to practice a breathing routine that allows you to expand not just your chest, but your abdomen. And you should get this stretch in all directions. If that's your practice and you get used to breathing in that way, instead of kind of this stressed breath up this way, all the time, your body's working for you in a way to help stretch that pelvic floor and lengthen it.
So like deep belly breathing. Is there like a special belly,
technique? But not just belly. Yeah, most people, they'll call it belly breathing, but really what we're looking for is this 3D breath where you're really breathing in all directions, because our lungs are not just in the front of us, right? Our lungs make up this whole rib cage cavity. And so we want that breath really to expand in side to side and front to back and down.
Okay.
Get a stretch.
I'm sure that takes some practice, which you likely teach.
Takes some practice, but kind of think about breathing. I say breathe like a J. So you're kind of taking that air and you're kind of channeling it down through your pelvis, and that can be helpful for people to kind of think about breathing down and in. So that's number one. Two for tension is unclench your butt. Don't tighten.
You caught me.
Don't tighten your butt. And people do it all the time, right?
I'm always clenching my butthole.
We're not just butthole, but your glutes in general, like the whole area. We just tend to tighten a deadlift, and you're coming up and you're reaching that end and you're tucking your butt under, right? You're kind of pushing through.
Yeah.
That's butt clenching, right? And so unless there's a specific reason why we're doing that over and over and over and over, why do we need to push that last little bit and constantly keep those squeezed? It just spills right over into that pelvic floor. And that's just a sign. If I see that, I'm like, that person probably, even if they don't have symptoms, probably tends towards a higher level of tone that may be lending itself to an abnormal level. And I wouldn't want them to get symptoms. So from a prevention side, unclench.
Okay.
Yeah.
Okay.
Yeah.
And the other aspect
is weakness, right?
Yes.
So from a weakness standpoint, if you have a weak butt, hips in general, but especially booty, you need to strengthen it up. If you have a lot of weakness in the joints surrounding that area, which is your pelvis and the muscles that attach there, are majority of hip muscles. Yes, there are some abdominals that come in, but hips in general, stronger butt muscles spill over and help you strengthen your pelvic floor. So even if you're not doing pelvic isolated exercises and you're strengthening, you're breathing, you're not breath holding, right? And you're strengthening your butt, you're going to get a stronger pelvic floor.
This is a bonus to weightlifting.
Bonus. Yeah, a bonus. Yeah. Yeah. I would say weight training, a huge proponent. I think it's awesome. At different levels, obviously everyone's different. But from a weight training standpoint, most of your clientele, I would assume, are probably going to not be needing to do an extra squeeze with their pelvic floor. They're going to need to be relaxing and releasing in between reps. To make sure that they're not holding tension, right? And as they get used to that, maybe at the end of each set, they kind of shake it out, make sure they're unclenched, make sure they're not holding everything.
Okay.
We don't need to hold. If we're constantly having to tighten our butt, our abs, etc., it tells us there's something off in instability. Yeah, we need to do that sometimes, especially for, if we're 80% of our one rep max or above. Yeah, you've got to brace, right? You have to do that. But if you're just working on pounding out those reps, etc., you've got to be able to breathe actively, relax, so to speak. I mean, there's going to be tension there. Just like holding and straining to the max, that's going to lend itself to pelvic dysfunction. Yeah.
Okay. Now, when it comes to men,
yes.
Do you see this often?
Different symptoms. Yes.
Okay.
So just to clear up any confusion, men have a pelvic floor too.
Okay. Yeah.
A lot of people are like, do they have one? They do. Their anatomy is obviously different, but the muscles are almost exactly the same, with one difference. And that is a muscle that kind of opens and curves to allow the vagina and the urethra in females. And in a male, that muscle is closed together because their urethra comes out a different way. It doesn't travel through the pelvic floor in the same place.
Okay.
So other than that, the muscles are the same. Okay. The other difference is with that extra hole of the vagina in females, we have a higher tendency to have certain weakness or dysfunctions like urinary leakage, etc., because of that extra hole. It's like putting a hole in your biceps, probably not going to function quite as well.
Okay.
So females in general tend to have more symptoms, but men do too. Most commonly in male patients, I would say that I see urine leakage almost exclusively in older men related to prostate issues.
Okay.
So that's not typically like a fitness realm that they might have leakage, but it's probably associated with a prostate, either prostate removal or some sort of a thing with that. But from a tension standpoint, yeah, I actually see that a lot. Most of my male clients or patients come in with pelvic pain.
Okay.
Because of tension, and they hold tension in some ways worse than ladies do.
Oh, okay.
Yeah, at least in the clients that I've seen. So a lot of that really, I'm going to lift really heavy, I'm going to strain, I'm going to look tough, I'm going to do whatever. Just really that pelvic floor has no relief. And most of their pain is represented as pain in the testicles, testicular pain, and anal pain. Okay. So it feels like they're like at their anus, at their butthole, like it's just very painful. And even sitting on it can feel really painful.
Okay. Yeah. Now, when it comes to females, what are some, I know we mentioned some of them, but some lesser known symptoms or signs of some kind of pelvic floor dysfunction?
Yeah. So if you feel like you get a lot of UTIs, but maybe you go get cultured and they come back negative, but you're kind of are somebody who has gotten a lot in their life and they just are recurring. Some positive,
good.
Maybe
so
some
good
not.
To hear. Okay.
That is a pretty common sign of pelvic floor tensioning dysfunction, like a tightness issue. There's a lot of associated nerve referral pains back and forth from bladder. So that's one.
Okay.
If you have a lot of abdominal pain or pretty severe abdominal pain, either outside of menstrual cycle time or within it, but more than typical, like kind of out of the, I kind of feel a little yucky, but I'm moving on with life. That can be a pretty common sign. Maybe you have endometriosis, and that is very much associated with pelvic floor tension.
Okay.
Maybe you're constipated a lot. That can be associated with pelvic floor tension, actually.
Okay.
Can we
just sidebar that for just a second? Only because I'm a competition coach and I deal with women a lot. And one of the common recurring themes also with myself when we get into a contest prep scenario, you drop a ton of body fat, you're still lifting heavy, doing all the things, is constipation. And while I know some of that is directly relinked to like the low fiber and low food volume, this might be another potential issue that is going on in the background. Yeah. So this is great news. Great.
Yeah.
Discovery.
So I would say from a prep standpoint, obviously way more about that, but yeah, if you're going to drop fiber, fiber and water bind and they work together, right? So if you're taking in extra fiber, you need to be taking in more water to be able to combat that. If that is shifting, it's going to impact the density and how quickly stool can move through. However, let's say the stool has moved, but you're having a hard time emptying. Maybe you're just really gassy. You're like, it feels like I need to poop. I just can't get it. So if that anal opening has a hard time, that anal sphincter has a hard time opening and relaxing, that is a pelvic floor tension issue, and or it's a coordination issue with the nervous system. So there can be some dysregulation, but most often that's not normally. I mean, it does happen, but it's not as common as tension. Yeah.
Okay. So you were saying constipation, and then
constipation. Yes. Okay. What am I? Urine leakage. We talked about that one. Bladder. I'm trying to think of really common ones. There's a lot of outliers out there.
Lesser known symptoms. Anything joint related? You mentioned hip pain.
Yeah, actually, especially if we call it unilateral, so like one-sided, right? So one-sided hip pain, that has a pretty high correlation to pelvic floor tension issues.
Okay.
So if you have like hip pain on both sides, or a known like, I just injured it, I got a labral tear, even with a labral tear, actually, that's associated with pelvic floor higher tone levels. But specifically like a one-sided hip pain or injury, that is definitely correlated. Many women know about what like a diastasis or a diastasis. There's two ways of saying that same word, that kind of ab separation. Sometimes associated, more often than not, that can be associated both ways, with weakness or tension. It kind of just depends on the pattern that we're seeing in the individual. But that ab separation, which we could sidebar on that too, because there's a lot I could say.
I get a lot of those. Yes.
Yeah, a lot of those. But that ab separation can be, if it's excessively wide, and we can talk about what that is.
It's diastasis.
It's diastasis rectus,
yes.
Right? But excessive width, there's a normal width range, and then there's an outside of normal width range, and then there's the behavior of it, right? So it's how does it work under pressure? What does it look like when you're loading? If it looks good, it's fine, right? But if it doesn't look good and the load is, that tells us something that could be happening in the pelvic floor too. And so it's not necessarily a sign of pelvic dysfunction, but unless you've rehabbed it and you are really aware of your body and you've trained it, it likely is correlated with a pelvic floor dysfunction.
Okay, good to know.
As well. Yeah. I'm sure there's plenty more, but that's kind of the big one.
Yeah, no, those are those are very important ones, and I'm sure there's plenty of women on here who were like me, listening to that for sure. So it's very common. I know we hear it often, not so much anymore, but with clients when we would do boot camp and girls are jump roping and they're like, I will pee myself. I'm like, yes, that's not normal,
No.
Yeah.
Yeah. It's especially with jump roping, it's a pretty, it's an explosive motion. So you have to absorb a lot of impact. So I could think of a trampoline, right? It's going to give and bounce, and it might hold up for a while, but as it fatigues, it's going to have a harder time. So that's a fast twitch muscle fiber response associated with endurance. Okay. And that needs to be trained if you have weakness in that, right? Jump rope in particular, trampoline jumping if you have gymnasts, etc. Yeah.
Now, are the treatment options, are they different based off of what the individual is experiencing? So let's talk like troubles with like orgasm, sexual pain, intercourse, things like that. Yeah. And then we'll move on to the urine leakage.
Okay. So in particular, especially with like intercourse pain related stuff, it's going to be different than I'm really weak and I just can't contract. So I can't get an orgasm because there's like nothing happening versus like I'm really tight, but I'm not having very strong orgasms because again, I don't have much motion. So similar ideas, but the treatments are very different for both.
Okay.
So with weakness, obviously it'd be a strength training program. Those ones are pretty more straightforward. You'd want to work on strengthening your booty, make sure you know how to engage your pelvic floor. So that might be a time for an isolated Kegel exercise in some of those cases. in the beginning until that muscle is now, oh, I know how to find it. And then you got to tie it into functional stuff right away.
Okay.
The more complex one, though, is when we're dealing with tension.
Mm-hmm.
So if somebody has a tight pelvic floor, it often is masking weakness in those cases. If they're having pain with sex, a change in orgasm ability, right? So they used to be able to, but now they can't. And they're just extra tight and having a hard time releasing, and or pain after orgasm, which also happens with that. We have to teach it how to relax. And so often as a pelvic floor PT, we're giving what's called a down training program. So we're trying to teach those muscles how to lengthen, how to relax. And it's not quite as easy as like stretching out your hamstring or
you have to
doing
think,
like some,
right?
It's different.
Yeah.
It's a lot of brain thinking in the beginning if you've never done it. And you're like, I didn't even know I had these muscles. Like, I just thought it was a pee hole and a poo hole. And I didn't even know. Right.
Yeah.
Right. And so it's just, it's a big learning curve. It's hard work in your head, not so hard. It's not like going to make you sweat. Okay.
Yes.
But stretching, if I had to give you kind of a general thing for people to do, develop a good hip mobility, back mobility, pelvic mobility, stretching routine, and incorporate breath work with it. That's probably the easiest thing to add in.
Okay.
And try to unclench. Like if you were to tighten your pelvic floor, like kind of squeeze it, try to do that kegel.
Yeah.
And then if you
doing
relax
it right now. Can you
does
tell?
it relax? You shouldn't be able to tell. If you can see it, you're doing it wrong.
Okay.
Yeah. So you should be able to relax it. And if you're like, I'm not really sure if I relaxed, that could be a sign that there's either a severe weakness where you didn't squeeze it at all, which is less common in the age demographic that typically is in more fitness, active fitness. But if you can't really feel like you're relaxing, it's probably not relaxing or taking a really long time to release.
Okay.
And that's a sign of tension.
I know this might be a basic question, but would something like working with someone as yourself for this type of issue and incorporating those exercises, I guess, mentally with something like yoga, would that be okay? Yeah.
I often, especially if people love yoga and if people hate yoga, we find something else. But if they do, we just modify certain yoga poses and say, hey, why don't you work on these? With yoga, it depends on the type you practice, right? There's different types of yogas. There's like the more meditative, long posture holding versions. And there's more aerobic, quicker movement postures. Typically, we're looking for something kind of in between, right? So we want to be able to hold it, but we don't need to sit there for 10 minutes or 5 minutes in one posture.
Yeah.
It should be comfortable. If it's like, whoa, this feels really tight, I'm having a hard time relaxing, there is no way your pelvic floor will be relaxing. And you're going to be like, oh, this is really intense, right?
Right.
Yeah. So it needs to be something that's just intense enough. You're like, wow, I really feel that, but light enough that you can relax into it.
Okay.
Whatever the stretch is, whether it's yoga pose, hamstring stretch, whatever. Yeah.
And then let's talk on, unless there was anything you wanted to add there, I was going to just move into the urinary.
As a general, I would say that's probably, there's a lot more, but it's
for sure
pretty individual on what people are experiencing and whether it's vaginal penetration or anal penetration. There's a difference on that too, and what type of treatment is included. So,
okay. Now moving on to something like urine leakage, dribbling, things like that with high impact sneezing. What are your thoughts on that? What are your go-tos?
Let's break again, because again, you can have it from weakness and you can have it from too much tension. So from a weakness standpoint, I would say if you are needing to make sure that you train your pelvic floor to turn on during those activities, start with something easier than that motion. So let's say you normally jump rope for 5-10 minutes, whatever the length of time is. Start with maybe some jumping jacks, and then you can pause in between as you work to train that muscle how to engage. So as long as you know how to do a kegel, which sidebar, over 50% of women who think they know how aren't doing them correctly per research.
Okay.
Should we
do like a brief how-to?
We can try. Okay. I'll give you verbal instruction. However, even with verbal instruction per research, most, at least around 50%, still are not doing them correctly. But I'll tell you this.
Okay.
If you were to insert your finger or a partner's finger, but so that you could feel it yourself, into your vaginal canal, you should feel not just I'm trying to show you with my hand, my hands, which doesn't help on a podcast.
Oh, this will be on YouTube. This will be on YouTube.
Perfect.
Yes.
It does not help. Okay.
Yeah.
You should feel a squeeze and a lift in.
Oh, okay.
Okay. And that's part that people, so there's different grades of strengthening or strength of the pelvic floor. To summarize it really generally, when it's just kind of like a surface, you kind of feel this tightening, but this squeeze just right on the surface. That shows that muscle is weak.
Okay.
It'd feel a pretty strong squeeze. I mean, obviously it's not like your sphincter. It's not going to feel like that, but you should feel like, oh, I feel it's like definitely tightening down on me. And you should feel like it's trying to pull your finger inside.
Okay. So like an elevator up.
Like an elevator up.
Yeah.
Yep. It should pull up and in.
Okay.
If you don't feel the up and the in part, that will definitely say, either I'm not doing this correctly or I have a weakness.
Okay.
Or potentially also could be you have a tightness. That's the trick of the tension issue that makes it tough. But from a weakness standpoint, as long as you can relax it all the way and you can feel some sort of squeeze, you're probably doing Kegels, whether or not you need some extra help to make sure you're doing full contractions. It'd be like trying to do a bicep curl and all doing like these, baby.
Right.
There's room for that. You might need that in some cases, but we might want to strengthen through full range more often than not. Right. Yeah. Okay. So that's Kegel. Is that helpful?
Yes.
Up and in.
Very up and in. Yes.
Okay. It's helpful to do it on an exhale too.
Oh.
So you breathe in and then you breathe out.
Oh, I just did one. It was magical.
Yeah. Up and in motion. Perfect.
Yes.
And the reason why that works with the exhale is because it's tied so closely to your diaphragm. And how your diaphragm
Makes
moves.
sense.
So it's like a piston. Diaphragm goes out, pelvic floor pulls up, push your air out, your diaphragm has to move up. So it kind of just assists everything in the movement.
Right.
Yeah.
Amazing. Okay.
Kegel.
Yeah.
There you go. If in doubt, see somebody and make sure you're doing it correctly. Yeah. Okay. So we were chatting about
bladder, some like exercises, some jump
impact.
jacks.
Okay.
Yeah.
So as long as you know how to do a Kegel, use that Kegel functionally. Make sure you engage that pelvic floor. Let's say I want to do a box jump. Maybe it's a smaller box jump than I have done, but I'm going to breathe in. I'm going to breathe out. I'm going to get my pelvic floor, that Kegel, engaged. And then I'm going to do my jump. And then I'm going to relax. And I'm going to see, did I hold it or is it already down? Did I hold it up that whole time? And then if I release it afterwards, does it drop back down? Awesome. That's great. That's what we want to do as we train. And more impact, we work our way up just like you would building any other muscle, right? You just add more and more load to that pelvic floor. And then eventually you're doing jump ropes, no problem, right?
Okay.
So you have to train for what you want to do, just like you would with a butt, a leg, an arm, an ab, or
Makes
whatever.
Sense. Yeah. Now, how long does this usually take? Is this just like an ongoing thing as far as treatment goes? Or is it like a set of exercises you usually recommend for people depending on the severity for duration?
That's a tricky question. And here's why. If you rehab the muscle only to a certain point, but you don't take that muscle beyond the level of which it feels hard, you will probably have to pretty frequently recycle back into those lower level basic exercises to kind of try to keep you right on the teetering edge of control and not control. Does that make sense?
Yeah. Makes sense.
If, however, you train your pelvic floor, you don't just do Kegels, you don't just do laying down exercises, but you take that muscle beyond that into functional motions, and then even more beyond that into athletic motions, whatever that may be, then you very likely, unless there's a pretty traumatic event in your life, like a really chronic, severe cough, right? Or some really severe allergies where it's just like it's ongoing and sneeze, that might be a trigger. Or having a baby, right? That's another big one. You likely will not have to go back and do those basic level, let me learn how to engage my pelvic floor stuff again. It'll just carry with you with the current fitness level that you have. That's the cool thing about muscles. Yeah. That's in a weakness standpoint. In a tension standpoint, however, the nervous system plays a pretty significant role of memory to holding tension. So an example of that would be when you get stressed, where do you feel like your muscles get tight? A lot of people say,
neck,
like
shoulders,
neck, shoulder, like a pretty common, like there are other areas, but that's pretty common, pretty standard. Your body likes to go back into the postures of habit and routine that it has been in before. And so when stress kind of comes up, your body goes, and you're like, why are my shoulders to my ears? I need to relax them, bring them down. Is it's an unconscious store of stress, which is why it's so highly correlated with the pain and the anxiety type spectrums. So when we have all that tension stored, any small trigger, especially in the beginning, when we're first starting to navigate this releasing process, can feel like it sets you back to the beginning. The difference is that it hasn't. Your body has learned so much in that change process that the bouncing is faster. But as time goes on and you get better and better at knowing when tension's coming in and stopping it from happening, doing some full days, doing some breath work for a few days, from some optional things that you've included yourself to reduce stress overall in your life, whatever that is for you, it's easier and easier and easier. However, it's a longer process. Okay. Does that make sense from a tension standpoint?
Yes.
It's trickier to unlearn tension than it is to strengthen.
Gotcha. Because it's like you said, when you're tense and this is
it's
just like
everything.
Your natural, right? Yeah. I could see how
and
that
you
would
don't
be.
Just get tension from doing a deadlift, right? You get tension from stress, which is totally outside of fitness. You get stress from diet. You get stress from so many things.
Yeah.
So it makes it a little bit trickier, especially the more severe it is. But many people just have higher tone levels, little symptomology. And so it's not as hard to fix. It just gets trickier when you are already into pain thresholds. It takes longer.
I bet. Yeah. Now, I don't know that this is related, but I was on Instagram and I must have clicked on something. And now I keep seeing these ads for these app controlled pelvic floor devices where you insert said mechanism into your vagina and you play a game on your phone, like a little app. Now, what are your thoughts about this thing? I didn't buy one, but I was like, I'm going to ask Sarah about this.
They are cool. Okay. They are pretty cool. They're a form of biofeedback. Biofeedback can be done in many different ways. It can be done with a therapist and their hand involved in giving you verbal cues while they're feeling. That's biofeedback. It can be done with electrodes on the outside of your body to kind of give you signaling. And it can be done by things being inserted that pick up on how much pressure and squeeze is around them. So they're really cool. I would say those devices are awesome. They're fairly expensive, especially for some people. And if you are looking for a functional turnover into fitness application, you may use them for a short-term period of time. And they're not really resellable since you're using it in your vaginas.
Yes.
So it's kind of like a just for you usage. They can be cool. And if you're like, hey, I have a pretty severe weakness in my pelvic floor, maybe you've been checked for it, or you're just having a really hard time engaging those muscles at all, it might be a kind of cool thing for you to try. Is it needed? No, I treat most people without ever using them.
Okay.
But you can use them and they're fun. People have a fun time playing them on your phone.
Yeah.
But I would caution you, if you think you have a pelvic floor because you've been playing a version of Angry Birds on there or whatever,
yes,
which is awesome, you still need to make sure that pelvic floor can perform with the activities you want it in. Right?
Okay.
So you can't stop at laying on your back playing or sitting on the couch with that inside. You can't really use them during they'd kind of fall out. They're kind of heavy. They wouldn't really stay in well during fitness. If they could, I'd be like, sweet. That can be helpful as an initial tool when you introduce a new exercise. But I'm kind of glad they don't, because becoming dependent on something can make it tricky when it's not in, and you don't want to be wearing, have something in your vagina all the time that's just sitting in there as a feedback tool. So,
right. So do you think that's helpful in teaching people the technique that they can use when they're not utilizing said device?
If you don't have access to a pelvic floor PT, either and or you don't want access, you want to try it at home, it can totally be a helpful tool. Doesn't mean you're performing them perfectly. No. Doesn't mean you're getting some contraction. Yeah. So that might be all you need. That might be good enough. But for people who maybe you've tried it or you're like, I have a lot more issues than just this one thing, I would recommend, before getting that, being assessed by a pelvic floor therapist, just to make sure you're doing the coordination correctly. And if you're just weak, use that puppy, play those games, have fun doing it, then tie it into your fitness. Totally fine. Okay. But you may also have high tension. And if you do, and you're using those, you can make symptoms worse.
Okay.
So that's the one catch, is if you run high and you're already tense with those muscles and you're just contract up here, you can just increase tension levels. And then you're like, why am I having more pain symptoms? Why am I leaking more when I'm lifting? Why is this happening?
Okay.
Yeah.
So if you buy it and you already have a pretty strong or overactive pelvic floor and you're playing to win all the points because your pelvic floor is so strong, you could be doing more harm than good.
Yeah.
Okay.
Yeah. Especially if you have a hard time relaxing after each contraction, right? Because then you're just trying to strengthen. It's like doing bicep curls just right here. And then you're like, why am I so sore and so tight and I can't straighten my arm out?
Yeah.
It's really tough to do. It's a similar concept in a very simplistic way to think about it.
No. Yeah. But it makes perfect sense. Okay. Yeah. Is there anything else you want to say about the pelvic floor that I haven't already picked your brain about? Like misconceptions, myths, common questions?
There's one other category that we haven't really talked about.
Okay.
And that is pelvic organ prolapse.
Oh, yes.
That's a pretty common one that people have either heard about or have experienced. And so organ prolapse, again, is it's an isolated thing away from the pelvic floor because it's literally just like the ligaments that hold the organs have stretched in some way. So those organs have descended down. Myth number one, your organs will not fall out of your body.
Okay.
Literally, they won't fall out. So
Okay.
people are afraid of that, right? When they feel a bulge there, they protrude out of your body, but they literally not detach and fall out of your body. So you're okay.
Okay.
Always rest assured your organs will stay with you. Okay.
Okay.
That's number one. Number two, if you are doing a lot of breath holding, even if you're pushing in those reps at high for a good reason, but you haven't rehabbed appropriately to know how to distribute pressure. Pressure distribution is very important if you have prolapse, because you can very easily progress the symptoms of that and make your prolapse worse. So making sure that you're distributing. So a good tip or way to cue that would be, instead of just taking a big belly breath and then kind of holding, try to breathe into your lats. Try to breathe high up in here and try to brace this way. It's kind of a different way of thinking about bracing. Because there is a place for breath holding, obviously, in lifting, but often we kind of teach to breathe and push into our braces or different things that's more abdominal. Yeah. And that just really puts a ton of pressure down. And so if you can teach your body how to brace higher, a little bit more like lat breath, that can be helpful to reduce that load. But ultimately, if you have pelvic organ prolapse and you have not rehabbed up to letting your core system know how to withstand that pressure and distribute it appropriately, you're going to be worsening your prolapse.
What organ do you usually see prolapsing?
There are three that are actually pretty common. Yeah. Bladder is pretty common. It's called a cystocele. If you've ever been told you have a cystocele, there are 4 grades of prolapse. Grades 1 and 2 are all up inside your vagina. Those ones are nice. They're really easy to treat from a PT standpoint. When we start hitting grade 3, we can normally do things. When we're at grade 4, you're normally in surgical candidate. Okay. Because things have it's just stretched out as far as the tissue is going to let it go. Uterine prolapse is also very common. That one is the one that if you do have uterine prolapse, you're going to see a lot more organ outside if it's in a more severe grade. Oh, wow. A lot of the time, doctors are like, well, we'll just do a hysterectomy and then you don't have it anymore. And there's a lot we can do before that point, because the uterus is a really good hormonal regulator. So if we can keep that uterus in and use it for hormone stuff and just rehab, you can avoid having that hysterectomy, hopefully, if that's the reason for it. And then the third is called a rectocele. It's when the rectum is not coming out of the butt, it's prolapsing into the vaginal canal. So you kind of can get this little balloon in the back, and that's pretty highly correlated with constipation as well. So if you have a balloon where a poop can kind of get stuck, where it's trying to come out, but it's stuck in like this pocket and it can't come out the anus, then that is pretty correlated too. But those all, it just kind of depends. Everybody's a little bit different, but those 3 together are, I would say the first 2, the bladder prolapse and uterine, are probably the most common.
Where do you usually see that in terms of population? Is it like older people? Is it just a span of?
You would think, yes, we do see it in older. But actually, I mean, I have prolapse. I have 2 types of prolapse after having a baby. So the most common, and I am a pelvic floor PT, like I know how to push a baby out. Like, there are some things you can't control.
For sure.
One is, if you have had children, did you have a really long pushing phase of labor? That's a pretty high risk factor. Just being pregnant in general is a risk factor for prolapse. Repetitive, heavy lifting jobs and or activities. If you're like a heavy lifter and you do it a lot.
More like powerlifting, you think?
Powerlifting. Yeah. Powerlifting, just lots of really heavy, lots of load, lots of poor breath management. That can be a risk factor, even if you've never had children. And then chronic constipation, lots of pushing and straining on the toilet.
Yeah. Okay.
Also a pretty high risk factor. Yeah. And just being genetically stretchy, which is me.
Yes.
So if there is a genetic component that also is there, and that is just if you're a more just a bendier person. Most people know, they're like, yeah, I'm pretty flexible. You probably are more that way. Or if you're diagnosed with something called Ehlers-Danlos syndrome, which is a connective tissue disorder.
Okay.
High
Now,
risk factors.
If anyone is experiencing anything that we've talked about, is the general first step is you get into your primary care and then need to be referred to a specialist?
There are two main routes, or whatever, to get to a pelvic floor PT. One is that if you want to go through your insurance, you go and see your primary care or your OBGYN or whoever, and they refer you to somebody. The wait times can be long, but you can totally do that. I believe, especially in California, it is also a direct access state, which means you can go see a pelvic floor PT without seeing your doctor. And you can see them with insurance coverage, et cetera, for up to 12 sessions. And then if you need to continue beyond then, you do have to have a signature from a doctor in order for insurance to continue helping pay for that. So that's kind of a joint try number one, all through insurance. The second is most pelvic floor PTs are cash pay. And I don't need to dive into all the detail as to why, but it has to do with insurance dictating how we treat, and it's not effective in this population because it's not very one-on-one. You don't have time to spend, and you can't really do vaginal work, et cetera, in a group setting. So it's very tricky to do PT with like 10 minutes of time individually when you need to work really one-on-one with clothes off, clothes on, it's just different. And so a lot of pelvic floor PTs do cash. And so that's direct access. You can walk right in. You can also be seen for 12 visits, no problem. And then there are people like me who have businesses online, and we buddy from any state, anywhere, because I also treat wellness clients. So there's a lot of different ways to get in. Longest wait times are going through doctor's offices and getting referrals to go over. But it's totally fine and doable. I've treated in that setting.
Okay.
And fine. Yeah.
So I think we'll wrap up there. But is there anything you want to add to this conversation? Because I do want to get some info on how people can connect with you for this.
Sure.
Yeah.
Sure. Happy to add on to that. I would say I want to give one caveat at the end, and that is if you have pelvic floor dysfunctions, it is not hopeless. There is treatment for you. I have seen severe cases of pain completely resolved. I've seen severe cases get a lot better, 80% better, where people can live their lives again. I've seen weakness and not wanting to leave the house because they're wearing lots of urinary pads go away or only wear liners. So if you think it's too bad and it's too late for you, it's not.
Amazing.
If you think surgery is the only option, it's probably not if you haven't tried other things.
Right.
So there's hope. You'll be okay.
And it's, I'm sure, requires a lot of patience to just be committed to the process. For sure.
But just like having a knee injury and you're like, I want to rehab this so I can work. It's the same idea. It's not different. It's just a different way of thinking because it's a part of our body most people don't think about or didn't know about. But it's very empowering, right? If you can go from my peeing my pants, I don't even want to go to the gym and I have to wear like a pad and tights and people can see my pad and my tights and yucky, to I don't even need that anymore. That's awesome.
Amazing.
Right? That's very empowering. And that's why I love what I do, because it's life-changing to people.
Yeah. I mean, you can definitely see you're passionate about it. You were like, excuse me, I want to talk to you about things. I'm like, let's do it.
I love it. Yeah. And it's just so much that people don't know about, which is why I'm a huge advocate for education. Because if you don't know, how are you going to get treatment? Yeah,
exactly. I think a lot of, at least our clients, have come through thinking like, this is just something they're going to have to deal with for the rest of their life, which I'm sure you hear often. I'm like, I know that's not the case.
Yeah. Yeah. And if we can prevent it, the United States, no matter how lovely or however not lovely you think it is, does not do a great job at preventative care.
I agree.
So if you can, and you have the means to, or the desire to do something preventatively to learn about how to prevent ultimately that's our goal. If we can just prevent things from happening, way easier than trying to treat when you already have symptoms, right?
Yeah.
So yeah.
Love that.
That's where I'm at.
Okay. Well, how can people find you to work with you? So what are the services that you offer? Let's start there and then tell us how we can find you.
Yeah. I am, the company that I own is called Floored Pelvic Health and Wellness.
Amazing.
I'm the only one. So it's just me, myself, and I.
Yes.
And it is an online business. The reason I started online is because I'm a mom of 2 and life is crazy. And I can schedule Sunday. If I can, I can just pick and choose my schedule. I can work it around. I can make it fit mom life better. It just works for me. It is not the gold standard of care. I would say gold standard is see a pelvic floor PT in person. However, there is so much you can learn and so much you can do to be helpful without that. And if it's needed, I refer to people in person. Okay. So that's kind of how that caveat I like to say, just because ethically, I'm like, I just want people to know the best practices in person. In the Central Valley, there's only a couple. There's not that many of us. So you can always drive to Sacramento or to San Francisco. Okay. There's people there too.
Okay.
So you can find me on, I have Facebook, I have Instagram, Floored Pelvic Health, and I have a website.
Okay.
It's flooredpelvichealth.com.
So floored, Floored, floored.
Yep. As in like the bottom or the floor. Floored pelvic, not public. That's a confusion for people.
Pelvic health.
It should connect you.
Pelvic wellness.
Pelvic health. It's andwellness.com is the name of the business, but the website and everything is Floored Pelvic Health.
Okay, awesome. We'll link all that up in the show notes as well, so people can have a direct link to find you and possibly work with you. It would be awesome.
I'd love it. Yeah, it'd be great.
Well, thank you so much. This was so great catching up and learning all the things.
Thank you.
I would love to have you on for other topics. What are some other topics that you would love to just kind of go off?
We didn't hit the diastasis or the diastasis, and that's a really common one in fitness. And so that's one that I definitely get a little bee in my bonnet over, and it's a fun one to talk about because there's so much misconception and poor information that people get online about that. So that'd be fun.
Well, that would be great. And then also possibly some postpartum stuff, because I do get a lot of people asking about postpartum. So we'll have to have you back.
Or fitness and pregnancy, how to modify. That's a fun one too.
Oh yeah. Amazing. Totally. Love that. So many options. Okay. Well, we'll have you back on, Dr. Tillay. That was awesome. I look forward to connecting with you further on more topics. And have a great night. Have a great day.
All right.
Okay.
Thank you.
Bye. Good to see you too. Boss bitch. Wait. Before you go, boss bitches, real quick. I know we've just reached the end of another awesome episode of Boss Bitch Radio, and I'm hoping that you're having a blast listening to us and learning with us. But guess what? The fun does not have to stop there. If you are hungry for more things boss bitchery, fitness goodness, all the mindset stuff, all of the things that keep you motivated, you need to sign up for my newsletter. I know, I can't believe we've gone over 150 episodes and I have not mentioned once for y'all to be signing up for my newsletter, because I've had a newsletter for 16 years. Every week I send out some content. Usually it's a wrap up of some of the podcast episodes with some snippets in there that's bite-sized that you can carry with you in your little pocket. But you wouldn't know unless you joined. All the cool bitches be on my newsletter list, and then you can just reply and we can chat. Those all go back to me, like it is me. I do write the things. So I would love to continue to motivate you outside of this podcast. I would love to pop into your inbox occasionally. No worries. I'm not going to spam you. I don't eat spam. I'm not going to send spam. But there will be some LOLs and some content that you won't want to miss. So join our Boss Bitch tribe. I'm going to link up the newsletter list sign up form in the show notes, which if you haven't taken a peek at the show notes, you should probably do that. There's some good ass links in there. There's some discounts, fun shit. Go find the email newsletter link, put your name on there, and every week I'll be whispering sweet nothings to you in your inbox. And it's a great way for us to stay connected outside of the podcast. All right. I'll see you in your inbox soon.